Mood disorders. Module 2, Persistent Depressive Disorder and Long-Term Management. Not all depression is episodic. Persistent depressive disorder, previously called dysthymia, is a chronic form of depression lasting at least 2 years in adults, 1 year in children and adolescents. Symptoms may be less severe than major depressive disorder, but the chronicity leads to significant functional impairment. This is often described as always feeling low. Persistent depressive disorder involves depressed mood for most of the day, more days than not, for at least 2 years, plus at least 2 of the following: poor appetite or overeating, insomnia or hypersomnia, low energy, low self-esteem, poor concentration, hopelessness. Symptoms are persistent, not episodic. Patients often describe, "I've always been this way. I just don't feel joy. I function, but I don't feel alive." They may appear high-functioning externally, but internally experience chronic emptiness and low motivation. Because it is chronic, it is frequently underdiagnosed. In persistent depressive disorder, assess duration of symptoms, functional impairment, sleep and appetite patterns, cognitive distortions, suicide risk, medication adherence, and social support. Even chronic depression carries suicide risk. Common nursing diagnoses include hopelessness, chronic low self-esteem, ineffective coping, social isolation, disturbed sleep pattern, and risk for suicide. Because symptoms are long-standing, hopelessness is often central. Outcomes should focus on functional improvement rather than dramatic mood elevation. Aim for practical outcomes and enhance daily living skills. Engages in one pleasurable activity daily. Reports improved sleep pattern. Demonstrates increased social interaction. Verbalizes one positive self-attribute. Adheres to treatment plan. Small, measurable progress matters. Interventions focus on encouraging structured routines, promoting behavioral activation, reinforcing strengths, supporting therapy participation, monitoring medication adherence, encouraging social connection. Avoid overwhelming the patient with unrealistic expectations. Treatment of depressive disorders occurs in 3 phases: acute phase, stabilize symptoms; continuation phase, prevent relapse; maintenance phase, prevent recurrence. Patients with persistent depressive disorder often require long-term maintenance treatment. Relapse prevention is key. Persistent depressive disorder can be treated with individual psychotherapy alone or in combination with medication management. Therapies such as cognitive behavioral therapy and interpersonal therapy are effective in addressing chronic negative thinking patterns and long-standing relational stressors. When medication is indicated, combining psychotherapy with pharmacologic treatment often leads to faster symptom improvement and improved functional recovery. For many patients, the combination approach provides the most sustained and effective outcomes. Recovery in chronic depression does not always mean symptom elimination. It means improved functioning, meaning-making, and sustainable coping. Patients may continue to experience vulnerability, but with tools and support, they can lead meaningful lives. Relapse prevention includes medication adherence, regular therapy attendance, sleep regulation, stress management, and early recognition of symptom return. Teach patients to identify early warning signs. If a patient states, "I felt this way for years," nothing will change. The priority nursing response is not to argue. It is to assess hopelessness and suicide risk while setting small, achievable goals. Chronic depression requires patience, structure, and consistency. In this module, we covered persistent depressive disorder, chronic symptom patterns, treatment phases, nursing diagnoses, long-term interventions, and relapse prevention. Depression is not always acute. Sometimes it is persistent, and that requires sustained nursing care.